Good morning, students. This is the second lecture of human anatomy or gross anatomy for medicine first year student. Good. So today we are going to see the neurovasculature of the lower limb. Last time we have seen lower limb, general skeleton of the lower limb, that is bone, muscle, and general structures at all. Today we are going to see blood vessels, vein, and the nerves of the lower limb. Good. Blood vessel of the lower limb or blood supply to the lower limb came from air. Good. Have attention. Last time we have seen blood vessel or blood supply of the upper limb. Blood to the body is from the heart. Then, ascending aorta, arch of aorta, then descending aorta. From arch of aorta, subclavian artery, then axillary artery, then brachial artery, then in the below the arm, brachial artery terminates as fibular artery and radial artery. Then they form arcuate artery. Finally, dorsal, metacarpal, and superficial and deep metacarpal. Then they form proper digital artery. So we have seen starting from the origin up to the tip of the finger. Today, the artery flow is the same. Artery is from the heart. From the heart. Therefore, the three parts of arch of aorta: ascending aorta, arch of aorta, and descending aorta. Now, descending aorta is going downward in the thoracic region, so it have number of branches to supply structure in the thoracic region. We will see this when we come to thoracic. Then this artery as it is going down, that is thoracic artery, as it's going down, it is coming from the thoracic to abdominal region by passing special demarcation or membrane which is found between thoracic and the abdomen. What is this membrane? Diaphragm. So it is passing through the diaphragm, then it enter abdomen. At this location or the site of perforation or passage of thoracic artery in the abdomen, that's become abdominal artery. This location is named as aortic hiatus or opening for abdominal aorta at T12, thoracic vertebra 12. Then after it is become what? Abdominal aorta. Abdominal aorta have number of branches again to supply abdominal viscera, muscles, and the back. We will come to this when we discuss about anatomy of the abdomen. Then as it is going down, abdominal aorta, once it is passed through the umbilicus. Do you know umbilicus? What we call by Somalic, hudun. So once it passes through this, below the umbilicus, 2.5 centimeter, it terminates. Then this abdominal aorta is become iliac artery. One is moving on the right side, the other is moving on the left side. So it divides into two. It bifurcates into two. On the right side, common iliac artery. On the left side, left common iliac artery. Then it is going down and divide into two again. Internal and external iliac artery. Internal iliac artery is going to the pelvis and the perineum downward. But external iliac artery is going to the lower limb. Good. What is the demarcation between the abdomen and the lower limb? Last time we have seen inguinal ligaments. Inguinal ligaments is a demarcation between the upper limb and the lower limb. So this external iliac artery, as it passes through the inguinal ligament, external, not internal, don't forget. Internal iliac artery, it is arterios pelvis. But external iliac artery, as it passes through the inguinal ligament, it is become artery of the lower limb. Now we call it femoral artery because the region is what? Femoral region. Femoral bone again there. Therefore, don't forget. Which one is artery of the lower limb? It is femoral artery. Femoral artery from where? From external iliac artery. External iliac artery is from common iliac. Common iliac is from abdominal aorta. Abdominal aorta is from thoracic aorta. Thoracic aorta from descending aorta. Descending aorta is from arch of aorta, then from iliac aorta, then from ascending aorta. I mean, don't forget the three part of aorta. Good. Now let's come to femoral artery. Is it the only artery that supplies the lower limb? No, it's not only femoral artery. Femoral artery is the major artery of the lower limb, but obturator artery is there again. Obturator artery is from internal iliac artery, not from external. Good, but the main artery is femoral artery, which is from external iliac artery at the middle of, or once it comes below the middle of inguinal ligaments. So it is continuation of external iliac artery. Good. So it have number of branches now. Last time we have seen femoral triangle. So this femoral triangle, the superior boundary is inguinal ligament, we have said. So these inguinal ligaments, look, observe this one. Here is the inguinal ligaments, which is moving up. This is the superior border of inguinal, superior border of femoral triangle. Which one is the lateral one? Here, sartorius, we have said. The lateral border. Which one is the medial? Adductor longus. Good. So this is a triangle, femoral triangle. What's the content of this? The major one is, we have say, vein, artery, nerve. Which artery? Femoral artery. Good. So here we will have number of branches from femoral artery. There are about major 6 branch, in which 5 of them are in the triangle, but one is, once it passes through the triangle, you will have the other again. Good. So which one is the branches? Here is superficial epigastric. Here is superficial external iliac. Here is superficial external pudendal and the deep external pudendal. Here is what we call it, profunda femoris, or deep artery of the femoral region, profunda femoris. The other is, once it is passed through this in a ductal canal, you will have genicular branch, which will give you a branch to the knee. Genicular means joint. So it gives you a branch to the joint. So these are the major branches from femoral artery. Here you can observe the major branches. How many branches from femoral artery? 6. Of the 6, profunda femoris. Profunda femoris is a major artery which have different branches. These branches are medial circumflex, lateral circumflex, and perforating branches. Perforating branches. Here is medial circumflex, here is lateral circumflex, here is perforating. First perforating, second perforating. It will go down up to fourth perforating. So we call it 3 perforating, and the terminal one is the fourth one. So how many major branches from profunda femoris? 3. Medial circumflex, lateral circumference, and the perforating branches. Medial circumflex have major 2 branch. One is moving upward, the other is moving horizontally. Which one move upward is named as ascending, and horizontally transverse branch. But when we come to lateral circumflex, it have ascending branch, transverse, and descending again. This descending branch is going down to the knee joint, and it will give you a branch in the knee joints. Good. The other perforating branches. The first perforating branch, it have a branch which is moving upward, ascending to the hip joints. Don't forget, those which are moving upward or ascending, they will give you special anastomosis at hip joints. Just observe here now. Here is the hip joint, and the special anastomosis are located at the hip joint. Observe this. Last time we have seen the general structures of what we call it, the femoral bone. You know, greater trochanter. So around the trochanter, you will have trochanteric anastomosis. Here, maybe if it is visible, it is from your handout. There are special 2 anastomosis. One is this one. Here is what we call it trochanter. Have you seen the arrows? Trochanteric anastomosis. The other is below a muscle here, special muscle, quadratus femoris. Below quadratus femoris here, this is special anastomosis. This is what we call it cruciate anastomosis. Cruciate, they are crossing each other. That's why we say cruciates. So this special anastomosis here, trochanteric anastomosis, there are major 5 arteries that come together to form anastomosis, but cruciate, there are only 4. So which one form? trochanteric anastomosis, like lateral circumflex, medial circumflex, a branch of first perforating deep branch from superior gluteal artery and inferior gluteal artery. What about cruciate? Transverse branch of medial circumflex, transverse branch of lateral circumference, ascending branch of first perforating, and a descending branch from inferior gluteal. Don't forget, only superior gluteal is not give branch to cruciate anastomosis. The other, all of them are the same for trochanteric anastomosis and the cruciate anastomosis. So don't forget this. Then as we are going downwards, we are going to find femoral artery as is going downwards. As the knee joint, it will give you special branch. This is what we call it popliteal artery. Here is popliteal artery. Like we have said, brachial artery as is going down, it's divided, terminate into radial and ulnar. Here again, femoral artery is coming in the form special branches. This is what we call it. Here it is what we call it popliteal artery in the knee joints. This popliteal artery have number of branches. These branches are on the lateral and the medial, superior genicular. Genicular means joint, I have told you, don't forget this one. Superior and the, medial and the lateral, superior genicular, medial and the lateral, inferior genicular, and the middle genicular. So there are major 5 branches. After it gives you in the knee joint, after it gives you these branches, look here, this is the popliteal artery, it will give you the superior 2, medial and the lateral, the inferior 2, medial and the lateral, and the middle, here is the arrow. Then once it gives you these 5 branches, it will terminate by giving you 2 artery here. This is anterior and the posterior tibial artery. Anterior tibial, anterior to tibial bone, posterior tibial, posterior to tibial bone. Good. So what is observed here? Anterior tibial artery is going downward. Which number of branches? Like nutrient artery is there. Like as it is going down, just you can see here the external special retinaculum. Like for the upper limb, we have the external and flexor retinaculum. Here, external retinaculum. Once it passes through the external retinaculum, it is become dorsal pedis. Have you seen here? Is it visible here? This once it passes through this retinaculum, here in the dorsum of the foot, we call it dorsal pedis artery. Here is the anterior tibial artery, anterior to tibial. Then here is the dorsal pedis artery. Then dorsal pedis artery will give you number of branches, malleolar branches, tarsal branches here, tarsal branches. Then it will come in the form of the arc. Here is arcuate artery, which is the same for the upper limb again. Arcuate artery forms the arcs. Then from this metatarsal artery, then finally supply up to tip of the finger, proper digital artery. This is anterior tibial. The other is posterior tibial. So posterior to the tibial bone, posterior tibial artery will give you 1 branch to the fibular artery, and the main posterior tibial arteries continue. Then tibial artery, posterior tibial artery, muscular branches are there to supply posterior muscle. For the bone, nutrients arteries are there. The number of calcaneal branch as you go downwards. Fibular artery to the fibula, those muscles located around the fibula. Then finally they are going downwards, and here they form communicating artery. Both of them are communicated to each other. Don't forget this fibular artery, sometimes we call it peroneal artery. Peroneal means fibular arteries. This is special anastomosis, which is located at the knee joints. Genicular anastomosis, sometimes we call it genicular anastomosis. Do you remember about upper limb special anastomosis formed as the elbow joint? How many arteries are there? 8 arteries. 4 of them are going downward, 4 of them are going upwards. 8 arteries in the upper limb, elbow. But when we come to the knee, there are 10 arteries. Don't forget, there are 10 arteries. What are these arteries? We have said from popliteal artery, there are major 5 branches. These are named as 5 genicular from popliteal. 5 genicular, medial and lateral, superior, medial and lateral, inferior, and the middle genicular artery from popliteal artery 5. The other, descending genicular from femoral artery, anterior and posterior tibial recurrent artery, which is going upward from anterior tibial. The other, circumflex fibular from posterior tibial, and a descending branch of lateral circumflex femoral artery. So these are major 10 artery which form genicular anastomosis. Sometimes we call it genicular anastomosis, which is formed at knee joints. Good. The other is blood supply to the ankle joint. So here are like anterior medial malleolar artery, anterior lateral malleolar artery, medial tarsal, like lateral tarsal arteries from dorsal pedis. These are from dorsal pedis, perforating branch from peroneal, calcaneal branches. It can be from posterior tibial, it can be from peroneal. These all are coming from and supply the ankle joints. Have you seen? This is simply to show you dorsal pedis as it is going down. It will give you metatarsal artery. Then after dorsal digital artery, dorsal proper digital artery. So up to tip of the finger is supplied. You can observe here. The other posterior tibial artery, as it is passing between the calcaneus and the medial malleoli, it will divide into two on the plantar side. One is on the medial side of plantar, the other is on the lateral part of plantar. So the one which is moving around the medial part here on the medial side, so we call it medial plantar artery. The largest part which is moving on the lateral side, this one, this is lateral plantar artery. Both of them are from here, from posterior tibial artery. Then they will give you plantar metatarsal, then they will give you proper digital artery. Finally, up to tip of the finger is supplied both on the dorsal side and on plantar side. This is a common site of arterial pulse in the lower limb. From here, we are going to take a pulse. Major 4 sites. So, like femoral artery as a midpoint of inguinal ligament. Don't forget, femoral artery is from here, external carotid artery at the midpoint of inguinal ligament. Below inguinal ligament, we call it the femoral artery. Above inguinal ligament in the abdomen, we call it external iliac artery. So from femoral artery and the midpoint of inguinal ligament, from popliteal artery in popliteal fossa, from popliteal artery in the popliteal fossa, from posterior tibial artery behind medial malleoli, what we have said, before it is divided into plantar and lateral, before it divide into medial and lateral plantar artery, you can take a pulse from posterior tibial artery between medial malleoli and the calcaneus. The other is dorsalis pedis, lateral to tendon of extensor hallucis longus. You can take a special, what we call it, pulses. So clinically, these are very important. Don't forget, clinically, these are very, very important sites of impulse. Good. This is all about the artery supply. The other is vein of the lower limb. Vein of the lower limb, like that of the upper limb, simply we can classify into two as superficial vein and a deep vein. Deep vein is the same with that of artery. Once you know the artery, you know the vein. This is the same. The course is the same, except artery is away from the heart, but vein are towards the hearts. So deep vein almost is the same with the arteries. The difference is superficial veins, like superficial of the upper limb. How many superficial of the upper limb you know? Major 2, like basilic and cephalic. The same is true here. There are two veins. These are named as great and small saphenous vein of superficial vein of the lower limb. Great saphenous vein, which is moving on the medial side, anterior to medial malleoli, it runs upward and passes through the fascia lata. Then finally it joins the femoral vein. It have anastomosis with the saphenous. So it is moving on the medial side, like that of basilic. Don't forget, in the upper limb, basilic is moving on the medial side, but cephalic on the lateral side. Here, a small saphenous vein is moving on the lateral side, but great saphenous vein is moving on the medial side. Great saphenous vein, sometimes it may be dilated, tortuous, and it is visible below the skin. This is what we call it varicose vein. This is mostly for those individuals who are standing for a long period of time, like nurses, doctors, teachers. So these are exposed to varicose vein, dilated. That's why we call sometimes this varicose vein is a penalty to humanity against gravity. Don't forget. It looks like that of a proverb. Penalty to humanity towards the gravities. That's the small saphenous vein. Already we have said it is moving on the lateral side, so it is drained to popliteal vein. Then popliteal vein is drained to femoral vein. Femoral vein drained to external iliac to common iliac vein, common iliac to inferior vena cava. Inferior vena cava finally bring deoxygenated blood to right part of the heart. That is right atrium of the heart. So this is what we call it vein of the lower limb. A deep vein, already we have said, femoral vein. Femoral vein drain to external iliac. External to common iliac. Common iliac to inferior vena cava. Inferior vena cava to right atrium of the heart. Good. So this is the drainage. The other and the last one is nerve supply of the lower limb. There are major special two plexus. Like for the upper limb, we have said, for the upper limb, brachial plexus. Here we call it lumbar plexus and the sacral plexus, the two. Lumbar plexus, we will have two special nerve here, obturator nerve and the femoral nerves. Both of them, their origin or source is the same. Obturator nerve from L2 to L4, femoral nerve again from L2 to L. This is the most common for the lower limb because anterior part of the thigh, muscle of anterior part of the thigh, supplied by femoral nerves. Muscle medial part of the thigh, they are supplied by obturator nerves, we have said. From lumbar plexus, it is not only these nerves. You know, lumbar plexus is from L1 to L4. There are other iliohypogastric, ilioinguinal. There are a number of branches. But from this, the most common for the lower limbs, is the two obturator and the femoral nerves. The other sacral plexus, the sacral plexus is simply from L4 to S3. The major nerves here is, there are a number of nerves. From this, the major nerve is sciatic, the thickest, the strongest, and the longest nerve in the body, which is composed of from L4 to S3. And it is the most common nerves in the lower limb because it is supplied almost except the anterior part of the thigh and the medial part of the thigh. It is applied all part of the lower limb, like posterior part of the lower limb and from the knee down, all, whether it is lateral, whether it is anterior, whether it is posterior of the leg, or all the foot again. So it is the most important nerves in the lower limb. So we call it sciatic nerve is the thickest and the longest nerve in the body, which is finally terminates as the knee joint, terminate as tibial and the common peroneal or common fibula, divided into tibia and the fibula. So sciatic nerve leaves the pelvis below the piriformis muscle. Sometimes when piriformis is become strong for those or thick, or for those individuals who are riding like a bicycle for a long period of time, the piriformis is going to push down sciatic nerve, compress sciatic nerve. So you will feel a pain in the gluteal region. You don't know the source of this pain, but you will feel a pain. This is what we call it due to sciatic nerve is compressed by piriformis muscle. That's why we call it piriformis syndrome. Piriformis syndrome. Don't forget this one. I will ask you this question. What is piriformis syndrome? Simply piriformis muscle is compressed sciatic nerve so that you will feel a pain in the gluteal region. What will be the treatment? The individual should take enough rest. Good. When you give intramuscular injection, IM injection in the gluteal region, where is the safe area of intramuscular injection? We are going to classify this into 4 quadrants: upper outer quadrant, upper inner, lower outer, lower inner. So you are going to inject in outer upper quadrant, the most safe, don't forget. If you go give to the other parts, the cord, when it is going downward in this cord, it have number of branches which pass through this through the other quadrants, so that you are going to damage gluteal nerves, so that you are going to impaired those muscles which are innervated by sciatic nerve. So please don't forget, the safe area is the upper outer quadrants. Good. Already we have said that sciatic nerve is below the knee joint. It is divided into two, common peroneal and tibial. So there are some special injury, especially common peroneal. It is injured at the neck of the fibula, most common injury. So during this, there are special laws like motor laws and what we call it sensation laws. Motor laws impair of muscle. When it is impaired, what happen? Impaired dorsal flexion, eversion, and flexion of the toes. This will be sleeping of the foot. You cannot take your foot upward from the ground. That is what we call it foot drop. Do you know wrist drop? Due to radial artery. Wrist drop due to the radial artery in the upper limb, but foot drop due to peroneal artery. Sensory loss, dorsum of the foot, lateral aspect of the leg, you will sense no when injury of this occur. Good. The other general abnormality in the foot, mostly which is related with the toes, like hallux valgus, lateral deviation of the big toe, hallux varus, medial deviation, hallux flexus, extremely flexed, hallux extensor, extremely extended, club foot, cannot stand with the sole of the foot flat on the ground, flat foot, absence of arc of the foot, entire of the sole of the foot touches the ground, talipes varus, inward deviation of hind foot, inward deviation, talipes valgus, outward deviation. So these are some of the abnormalities. Mostly you will see this in the embryology. In the embryology, that's all about the lower limb. Then in this chapter, we have seen neurovasculature. Mostly focus on neurovasculature. Please don't forget to focus on the neurovasculature. This is all about the second semester of anatomy again. Don't forget, in this anatomy, we have seen 3 chapters. That's general anatomy, lower limb, and upper limbs. Then I have sent you assignment, special assignment again. Please don't forget to do your assignment. Your assignment will replace replace the area of the what we call mid exam. So for the final exam, I will wait the message from your university managements. Then after, mostly I will send you some message from which chapter we are going to take final exam. Most probably maybe half of the upper limb and the lower limb. So I will tell you later. See you for today. Don't forget to read more. And if you have questions, please don't hesitate to ask me any question or write me on my WhatsApp. See you next. Bye.